Good morning. My name is Dr. Natalie Gunning. I'm a physical therapist with Spalding University. Today I'm here to talk to you about posture and why it's so important since we're all having to work from home a little bit more than we all anticipated. So we'll get started. So why are we worried about posture? As most of you are aware of, there's a pandemic going on, so thousands of us have had to relocate to home, either for work. Our kiddos are having to learn online. We can't go out as much because gyms, movie theaters, restaurants are either closed or at a reduced capacity. So we're spending a lot more time sitting, either working, watching TV, or reading. Our bodies are not designed to sit for long periods of time. They're meant to be upright. We know this from studies of truck drivers who have to spend a lot of time sitting. We've realized they're at more risk for back pain, shoulder pain, heart issues, even early mortality. So it's really important when we're sitting to be as ergonomic as possible, meaning to decrease stress on the body. Poor posture can affect everything in your body pretty much, all the way from your neck to your feet. It can cause decreased circulation, headaches, carpal tunnel syndrome, and actually the more you sit, the more tired you get. So this presentation is a step-by-step guide of proper positioning from your head to your feet. Due to technological issues I've been having, I'm sorry I had videos inserted of me doing the exercises. For some reason they won't work. So you might have to Google them. I'll talk you through them as best I can. Again, this is just a little disclaimer. This is not meant to be in lieu of medical advice. If you're having issues with pain or injury, please contact your physician or physical therapist. So we're going to start with the neck. So a forward head posture is what we call when people are sitting like the young lady at the bottom. So as you can see, her ears should be in line with her shoulder blade and she's coming way forward. This top photo shows how detrimental that can be. So every little bit we go forward, it puts more and more weight on your spine. So instead of your 12 pounds of your head on your spine, you could end up putting 42 pounds of pressure on your spine, which can lead to herniation of discs, pain, arthritis, fractures, all that stuff we don't want to have. This also increases muscle tightness, especially of the upper traps, suboccipitals, levators, and scalenes, which can cause something called tension headaches. So you're more likely to have headaches more often and more frequently. It can cause neck pain, shoulder pain, and also decrease the range of motion or the movement that you have in your neck or your shoulder. So this picture does a really nice job of showing how it should be. So the first thing you need to consider is your computer monitor. So your monitor needs to be at eye level. It should be no higher than 2 inches above your eye. So that way your neck is in a nice neutral position. You're not looking up and you're not looking down. If you're unable to raise or lower your table, you can use books to put under your computer to help raise it up. And that's what we do at my house. Also, if you use a phone a lot, you might consider using a headset. If you're using a cell phone, or I don't know who uses an old school phone, but one with a cord on it. If you kink your neck over to the side, it can cause tightness on one side and overstretching on the other. So again, we want that neck in a nice neutral position, so a headset is really helpful. We also need to think about our eyes. So you need to look away from the monitor every 20 minutes just to give your eyes a little break. The computer emits a lot of blue light, which can cause a lot of fatigue and also increase headaches. You can also invest in a pair of blue light blocking glasses. I found a pair off Amazon that were super cheap that I found are helpful, and it helps me sleep better at night too, actually. So neck exercises. The first one in the man in the blue shirt, he's performing what we call a cervical retraction. So what you're going to do is tuck your chin down so you're kind of in a nice neutral position, and then you're taking your head straight back, almost like someone's getting in your face. It's a very, very small movement, and you should feel a little tension in the back of your neck. I usually have patients hold it for 3 seconds and do about 15 reps. To the right of that, the little cartoon drawing is a man doing an upper trap stretch. So he's just simply grabbing one side of his head, pulling it over very gently, and you should feel a stretch in the top of the shoulder that his head is going away from. If you don't, you can put that same arm behind the back, as you can see he's doing in the photo, and that increases the stretch. I wouldn't hold stretches longer than 15 to 30 seconds at a time, and I would do this 2 or 3 times. The final one is a scalene stretch, very similar to the upper trap stretch, except he's looking up towards the ceiling, and you'll feel the stretch more in your neck region. This is a big one I've been seeing a lot recently, are shoulder issues from poor posture. A lot of people think they've torn the rotator cuff, and really it's just a postural issue where the shoulder doesn't have enough space, so it's causing pinching and hurting, and they think they've torn the rotator cuff. So as you can see, all these ladies have their shoulders rounded forward, so they're not sitting back with nice tall posture. The two ladies on the right and in the bottom need to raise their computer monitors because you can tell they're looking down. When your shoulders round forward, you can have shoulder impingement. You can have thoracic outlet syndrome, where you've got a lot of nerves that are in your armpit area. So when your shoulder is rounded forward in, it pinches those nerves and can cause numbness, tingling, pain down your whole arm. It also causes increased trouble with reaching, dressing, and just basic household chores, and also reduces lung capacity because, again, you're all caved in, so those lungs can't fully expand like they should. So this picture does a nice job. So if you look at the very center, your shoulders need to be up, back, and down. So you want to avoid hunching over at your laptop. So you want to make sure your chair is not too far away or too close to your work area because you're more likely to hunch. And you also should be sitting all the way back in your chair. If you're not all the way back in your chair, if your upper back's not supported, you're probably hunching forward and rounding your shoulders. So the first exercise are backward shoulder rolls. So I see in a lot of yoga videos, they'll have you go backwards and then forwards. I don't agree with that. I think you should just go backwards because, again, we do so much in the front. Our anterior chain is really, really strong and our posterior chain not so much. So all you're going to do for a backward shoulder roll is take your shoulders up, back, and down. Then next, underneath her, we've got what's called a pec minor or corner stretch. So this is to stretch your pectoralis minor. So she's got her arms against two corners of the wall, and she's just gently leaning forward into the wall. This is pretty aggressive stretch in the front of your chest, so your arms might not be able to go quite as high. Then next, at the top right, is a scapular retraction. So he's just squeezing his shoulder blades together. So I tell patients to pretend they've got $1 million bill between their shoulders, squeeze it together, and then relax. I have them do about 10 reps twice. And then the final one would be wall angels. So you're going to find a nice blank wall, head, booty, arms, hands, all flat up against the wall. And then, like when you're a kiddo, you're going to try to make a snow angel in the wall pretty much. This exercise is really difficult, especially if you're tight. It's hard to keep all of those body parts against the wall, so it's hard to do this exercise correctly. Some patients, the exercise is just trying to hold themselves at the wall with everything touching for 10 or 15 seconds, which is totally fine. Low back issues can also arise with poor posture. You're at an increased risk for a herniated disc or a disc bulge. Sciatica is also common, where the piriformis muscle tightens and compresses the sciatic nerve, causing pain and numbness that shoots down your leg. Muscle tightness, hip impingement, and pain are also very common. So in this first photo, the lady, her low back is not supported. Her upper back is, and her whole low back's just sagging there, so that's putting a lot of pressure on the discs of her low back. The gentleman next to her, as you can see, his upper back is not supported, so he's rounding his shoulders forward. His computer monitor is too low, so he's just at increased risk for all sorts of issues. And then the lady in the bottom looks like me when I'm working. It's something I'm guilty of. She's sitting on the very edge of her chair, way too close to the monitors, so no back support, everything's pulling forward. So these are all examples of how not to sit. So this lady does a really nice job. You want to make sure you're seated all the way back in your chair. Your feet should be firmly planted on the floor, as well as your low back and mid back firmly supported. If you can't get your feet on the floor, you either need to lower your chair, get a footstool, or again, go to some books or whatever you have at home to help raise it up. If you're lacking support or you feel like you need a little extra, you can use the lumbar roll, which is what this lady has in this photo, or you can roll up a towel and put it behind your back for additional support. So these exercises, the first one is a long trunk rotation. So you're going to lie on your back with your knees bent and you're just rocking them side to side. This is a gentle stretch. It helps stretch out your low back and your hips. It should not be painful. And you're just going to go to where you feel stretch and then rock to the other side. I usually have patients do a couple minutes of this or 20 reps, whichever they prefer. To the right, sorry there was a video of this that wouldn't work. But this is a press up. This is a fairly aggressive exercise. I just wanted to include it, but I would not recommend doing it until you've talked to a doctor or a physical therapist. But it looks like a cobra essentially in yoga, where you're pushing your upper body up off the mat, but you're keeping your lower body down. So it helps strengthen your back extensor muscles. Below that is the piriformis or figure 4 stretch. So one knee is bent, the other one is crossed over in a figure 4, and then you simply push that knee away from your body. You'll feel a stretch in kind of the outer part of your hip, and I would hold it for about 20 to 30 seconds. Finally, the posterior pelvic tilt. If you can tell in that first photo, most of us, if we lie on the ground, we're going to arch our back like that, which is an anterior pelvic tilt. It puts a lot of stress on the back and it weakens the abdominal muscles. So what we want to do is you're going to pull your belly button in towards your spine, try to flatten your back, your low back into the ground, and hold that for 5 or 10 seconds for 5 to 10 reps. Lower extremity issues. Usually if you're having pain in your foot, it's from a disc issue in your back. However, because of your posture, you are at risk of impaired circulation as well as swelling. So the first photo here, they are all crossing their legs. So we don't want to do that. That's going to impair circulation. Our feet, again, need to be flat on the floor. So no to crossing your legs. The lady in the red shirt, her chair seat is too high, so her knees are in a good, position. She's not past 90 with her hip angle there. But as you can see, she's using support of the chair bottom, and her computer is too low. So really, if she would lower her chair, that would fix 2 issues. And then the other lady, her chair is too high, so she has her feet flat on the floor, but to compensate for that, she's having to sit on the very edge of her seat, and as you can see, her hips are not at a 90-degree angle. So I put this picture of the kiddo to remind you that kids need to be ergonomic too. She's doing a good job sitting here. It'd be more ideal if she was a little bit further back in the chair, but we want to make sure our knees are facing forward, our hips are not flexed past 90 degrees, and our toes are not turning in or out. And again, just make proper adjustments or add a footstool or books as needed. These are pretty easy things you can do just sitting there right now while I'm sitting here chatting. So the first one is ankle pumps. So you're just pointing your toes up and down, kind of like you're tapping your toes when you hear a song you like. The next one are ankle circles. So I usually have people draw 20 circles clockwise and 20 counterclockwise. So you're just pretending your big toe is a pin. And then finally, a hamstring stretch. So this is an easy one to do. This one you can sit on the edge of your chair for, but you're going to have one knee bent, one straight out, and you're just hinging forward at your hips till you feel a slight pull in the leg that is straight. And again, with all stretches, I wouldn't hold it any longer than 30 seconds. Some other helpful hints, I would try to get up at least once an hour to avoid stagnant sitting. This is going to help improve circulation, lung function, and give you a little bit more energy. If you have the means, consider a standing desk or sitting on a Swiss ball for more core activation. The Swiss ball can be quite challenging, so make sure you've got an adequate level of baseline balance and physical fitness. Another good thing to talk to maybe your physician or physical therapist about. As far as references, most of this is just based off my knowledge of seeing this over the years, but I did pull some stuff from MedBridge Education. The images were just stock photos from the internet that I Googled, and then the video I couldn't get to play was from Excel Physical Therapy and Fitness. So thank you all for taking the time. If you have questions about anything or the exercises, feel free to email me at ngunning@spalding.edu, and I appreciate you all taking the time to listen to this presentation. Take care.